they are more willing, I would use that term, to seek healthcare when they feel maybe a little headache. A man will not really do that, and that comes from
a man wants to die fast.
How they're culturally, I don't know, it's a cultural orientation or societal orientation where they use colloquial terms like a man needs to, you need to man up, or a man needs to be tough or strong and all that.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll.
Alright, greetings and welcome to the second episode of the African NCD Champions Podcast, Season 3, where we'll be talking about non-communicable diseases, what they are, how to prevent them, and contemporary issues surrounding these diseases. Today, we are talking about health-seeking behavior, why it is important, what is it, and we're talking about it in the context of non-communicable diseases. And without further ado, I'd like to ask you to really talk to us about health-seeking behavior, what it is, and why should individuals be engaging in health-seeking behavior.
Okay, thank you, Steve, again for giving me this opportunity to talk about something that is really close to my heart, health-seeking behavior, something that I've engaged in research in Rwanda and also in Kenya, trying to look at really why young people, or even the general population, present with certain health-seeking behaviors. I almost got to the definition, but I want to define health-seeking behavior as an action taken by an individual who perceives himself or herself to be presenting with a health problem, and who would like to seek remedy or a solution to that, finding appropriate healthcare solution. So, that, I think it's a lay definition, but I would also just add that it's, people feeling motivated to go and seek healthcare services when they feel that they should do that. So that's really the definition of health-seeking behavior. And I don't know whether to extend this discussion by asking you why it's important for us to talk about health-seeking behavior, especially in the context of non-communicable diseases.
Yeah, I think it's a very important topic for us to really be talking about health-seeking behavior, especially in the context of non-communicable diseases, because again, how do these non-communicable diseases present? They present by developing over a long period of time, and so if you're not keen to recognize the signs and symptoms and consequently seek services to check and remedy, eventually you get to develop non-communicable diseases over the long term. So when it comes to non-communicable diseases, health-seeking behavior is such an important topic because it can really be the pathway to helping to prevent a lot of non-communicable diseases through regular screening, but at the same time it could be a pathway to help control non-communicable diseases through early detection. So when individuals go to the health facilities to seek healthcare, when they feel they are a little bit sick, or when they feel that there is some signs and symptoms of sickness, and individuals move to check, then they are really helping in terms of really reducing the development of non-communicable diseases and controlling these diseases, especially through early diagnostics. Which brings me to something that I sort of want to push back to you again to really elaborate on how has health-seeking behavior presented, and what is the facts and statistics saying, especially around the roots of health-seeking behavior and how it has affected the male and the female gender, because there's some very interesting dynamics in how these genders approach health-seeking behavior.
Yeah, I think it comes from the understanding that both, male and female really present, have different health-seeking behaviors. For instance, I think this is something that we've, talked about, but I'll just emphasize that, for women, they are more willing, I would use that term, to seek healthcare when they feel maybe a little headache. A man will not really do that, and that comes from
a man wants to die first.
How they're culturally, I don't know, it's a cultural orientation or societal orientation where they use colloquial terms like a man needs to, you need to man up, or a man needs to be tough or strong and all that. So, if somebody meets you as a man that you're from the hospital, you're feeling a little headache, you're like, just headache. You're going to the hospital just because of a headache. But this actually could be a manifestation of, a bigger problem to come. So, or it could be a tip of the iceberg, so to speak. If we don't prevent it early, a woman goes to the hospital, and that's why I would say women have longer life expectancy compared to men. Because men would be like, okay, fine, let me wait and see how this pans out maybe the next morning. And by the next morning, you find that, this has really festered, and now he's at a critical condition. So there are a lot of gender perspective around health-seeking behavior, and women tend to be more willing to go for these healthcare services and NCD services. Look at even cervical cancer screening. Women go for these things, and there are a lot of
as compared to prostate
cancer screening. So you see, women would be more willing, and you know what it takes to screen for cancer, but for cervical cancer. But men, the statistics that are really there, that men really are not going for these things, because why would they go before they feel it? Why would they go before they feel it? They will be termed like they are behaving like, the word that is being used, and you're behaving like a woman, like a small headache, and you're in the hospital. So health-seeking behavior is a very, very important topic to talk about in non-communicable diseases, because this is really the beginning of everything. If we don't have those health-seeking habits, then it means we develop diseases, they just fester, and before we realize it, we are at a critical condition that we cannot be helped.
Yeah, so I sort of want to steer this direction towards an interesting concept when it comes to health-seeking behavior, which is the context of overutilization of health services. Because ideally, what health-seeking behavior encourages individuals to do is, when you feel like there is a sign, there is a symptom, you are not well, you go and seek the service. So you go to the hospital, you go to the clinic, you go to the service center to seek a service. And there is a school of thought that says that this might be wrong, especially when considering the broader healthcare system, because a lot more people will be going to the hospital to seek services, and as a result, overutilize the existing services. And there's another school of thought which says that we are encouraging a lot more people to actually go and utilize these preventive healthcare services. And this is where I need to hear some of your comments around what would be your opinion on health-seeking behavior as it compares to overutilization or underutilization of health services.
Okay, that's an interesting and somewhat controversial concept around whether you want to encourage people to go for healthcare service. And I think the first school of thought you're talking about, where there's overutilization, I think I need to pin it to unnecessary utilization of healthcare services. Because when people are, everyone is willing to just go to the hospital and seek healthcare service, because health-seeking behavior would also mean that there are people who are going to the hospital necessarily, they're not sick, and they're just going for health checkup. But the second school of thought, which it's about promoting, encouraging everybody to just go for healthcare services, because in the long term, that will be, if you look at it in terms of the health economics, it will prevent government spending too much on healthcare if people are healthy, because you need a healthy population to be really able to also be productive and all that. So I think the question around underutilization and overutilization of healthcare services really goes back to when health promoters to think about when designing health promotion programs, the unintended consequences, because also there as unnecessary utilization of healthcare services can also be a problem for governments if they have to be spending a lot of money on people who actually do not need those things. So I think it's about now being able to identify the population that are really at risk and really encourage them, and try to segment the population and know that, okay, this population is really at risk and they could be encouraged to access these healthcare services. And those who do not really require, because you've done the profiling and you've known that really these people are at risk, and you encourage them to seek those healthcare services. And those who are not really at risk or do not really require them, or could leave those services to those who require these health services.
Yeah, I think that's an argument that I slightly,
disagree with or something.
Yeah, a little bit, because from where I see it, I'm the kind to really encourage people to go seek those services when you're feeling sick, when you're feeling at risk, and even sometimes when you're not sick, just go get your screening done, go get your diagnostic checkup done. And this boils down to the facts of the day. So currently, we don't have an issue of overutilization of health services. In fact, the reverse is true. We have an issue of underutilization of health services, especially when it comes to preventive healthcare. So my overriding message is always to encourage, whether you're just feeling it's a slight headache, whether you feel you wake up and something is not right, go get checked, because there's a lot of these services that are going underutilized because everyone else feels like that's a small issue, I want to go get checked, and then everybody doesn't go, and then those services go underutilized. The impact of them going underutilized is much huge, and it's much bigger compared to if these services are overutilized, especially at the preventive healthcare stage. Because at the end of the day, what we want, worst case scenarios, say we underutilize the services, healthcare services at the preventive healthcare stage. What happens is that as individuals continue to grow, the diseases continue to develop inside of them, and then they manifest 10 years later, and now everybody is sick with cancer, diabetes, obesity, hypertension. Everybody is going to the hospital to seek curative services for what would have been prevented at the preventive stage, And at the curative stage, it's much more expensive, consumes a lot of resources, a lot of drugs, a lot of personnel, and as we know, our systems are understaffed. There is not a lot of beds in the hospital to accommodate. There's not a lot of experts in these services to accommodate. And so that has been, and in fact, I think the reason why we are seeing a continuous sharp rise of non-communicable diseases is because for the longest time, individuals have been underutilizing preventive healthcare services. And when these diseases develop later in life, they now overutilize the minute curative and management services. So that's one argument. And when you go to the other side, which is overutilization of preventive healthcare services, the risk is not as much. We might see individuals go there and overutilize, and maybe we have to train more community health workers. We have to train more public health workers. But these are expertise that can be easily trained compared to the more technical expertise that would be needed for when there is overutilization at the curative stage. So I'm always a proponent or a strong believer that can we please go and really utilize the health services, especially at the preventive stage. If possible, overutilize that, because the cost for that is minimal compared to the cost that you will incur when now you want to seek these services later on in life. Which
really, I know you want to ask me a question.
Yeah,
but, there's something that you've mentioned. I think we are both in agreement.
Yes.
The only thing that is, I'm trying to say is that me being a proponent of, let's develop or people seeking health, but I'm saying the unnecessary utilization of healthcare resources is what I would caution, because we're coming from a background where look at Kenya. The total healthcare expenditure is how much? What percentage? It's not even above 15 as proposed in the Abuja declaration. So if we are saying that, okay, let everybody go over there and do what, I think, for me, what I'm trying to say is that unnecessary utilization, but indeed, people need to develop that health-seeking behavior. And just to bring it and just maybe mention that health-seeking behavior is not just about going to the hospital.
Correct.
And that is where we might also be missing the discussion, that it's not about, I'm sick, I'm going to the hospital. Yeah, looking at it in the context of NCDs, health-seeking behavior means doing what is necessary to address your NCD vulnerabilities. For instance, you working out in the morning, doing the 30 minutes moderate intensity exercise every morning, and you eating good food, you not living in an environment where the air is polluted, you avoiding things like alcohol and tobacco. That is you seeking help. So health is not just about going to the hospital, the facility, the brick and mortar. Health encompasses a lot of things, and in the context of NCDs, health-seeking behavior means you every day wanting to be healthy by doing the necessary to address your NCD vulnerabilities. Now you can ask me the question you actually.
That's correct. So you already just answered the question that I was going to talk about, which is expounding on health-seeking behavior beyond seeking services to the hospital, which is something that you've already really touched on.
Or rather, I could ask you a question. Really, what are the barriers to health-seeking behavior?
Yeah, so there's a lot of barriers to health-seeking behavior that I could mention, and maybe I'll mention 3 key barriers as I've seen in the communities that prevent people from seeking health. One is just the lack of information. A lot of individuals don't know that they're supposed to go and seek health and go and develop healthier habits. They don't know that these services exist, and in fact, statistics show that some people and a lot of people go to their first medical checkup at ages over 30 and above.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at StoryLink and at NCD Champions. See you on the next one.